Hi, my name is Annelieke Driessen and I work as an assistant professor at the London School of Hygiene and Tropical Medicine, which is a public health institute, but I work there as a medical anthropologist. What is anthropology? The word anthropology is made up of the Greek word anthropos, which means human, and the word logia, which means study. So the word itself tells us that anthropology is the study of humanity, so it's interested in social relations. Medical anthropology then is a sub-discipline of this discipline, so of anthropology, and generally it's interested in questions to do with health and illness, and how people deal with health and illness and how care is organized. So medical anthropologists, for instance, speak with patients to gain a sense of how they live with a certain condition, what it means to them, and they work also with healthcare professionals to understand how healthcare is provided and what it would mean to do that differently or better even, and then better for whom and what ways. And they might also work with people to improve outreach activities, to make them more sensitive to what we also call a local perspective, so to the people they're meant for, often by engaging these people in the design of these outreach activities, but also by bringing more to the fore what is important to those people and what they need. And that all to make the impact of those outreach programs bigger. So where do you do anthropology? For many years, social and cultural anthropology was associated with the study of remote places and small-scale societies. Now, while some anthropologists still go abroad and work in societies where they weren't born or grew up, now it is also very common for anthropologists to work in their own societies and in communities even that they're really familiar with from their own life. So anthropologists don't do research in a lab, although they might if they're interested in the people working in the lab. But generally they work in real life settings. So they work with what we call naturally occurring data, so things as they happen when they happen. So for my work, for instance, I work in hospitals and I've worked in nursing homes and care homes for elderly, and I might also work in people's homes if that's what the research is. So currently I am doing a research on people who have been admitted to intensive care units with COVID, and I'm interested in their experiences in the ICU, so that's the intensive care unit. I'm also interested in how they make sense of the parts that they don't remember, and how they deal with that family members couldn't be with them there at the time, and how they're doing afterwards, and what they're doing to get support and to deal with their symptoms and problems that they experience in everyday life. I also talk to their family members, and later on in the study I will do what we call focus groups, so that's essentially a group interview where I will be speaking to healthcare professionals and allied healthcare professionals and therapists and lots of people interested in the topic to see how these patient stories can be used to do better care in the future. And that is in no way meant to say healthcare professionals didn't do well. It is much more to together with those healthcare professionals and together with patients really reflect on what can we learn, and if we don't reflect on this, we might just miss out on a few opportunities to do things differently. So that's where you do anthropology. Now, how do you do it? I've already given a few things away. So to me, the main thing in anthropology is to be curious and to stay vigilant about things that we take for granted and to ask questions about it. So often in anthropology, we'd spend a lot of time with the people we're trying to understand to get a more complete sense of what things are like for them, how they talk about them, how they deal with them. And we call that hanging out or participant observation, which sounds like a paradox, and in a way it is, because you're trying to be both an insider as well as that curious outsider who says, interesting, why do you do it that way? And that's really a tool for anthropology to work with that curiosity. And like I said, we also work with very formal or more formal research methods, such as observations or interviews or focus groups. But specifically also we see small talk, conversations as a way to gather information, and that we then take notes about and try to find trends in. So why do I do anthropology? Anthropology to me provides new perspectives and opens up new avenues for doing things differently. Through contrast, we find that the way we took things to be the one and only way is just one of many ways. So it opens up avenues for doing things differently in that way. Like I said, anthropology allows you to be curious and to ask why and to learn from different settings and different situations. And in that sense, anthropology doesn't necessarily offer solutions for problems, but it provides skills and knowledge that enable us to tackle complex issues in competent and relevant ways. What do you have to do to study or to become an anthropologist? Well, you can study anthropology, and specifically medical anthropology, in many sites in the UK. Medical anthropology degrees are, for instance, in Edinburgh, Cambridge, Oxford, Brunel, London, Durham, so in many places. I studied cultural anthropology at first, and then medical anthropology for my master's, and I did my PhD also in medical anthropology, and that was all in the Netherlands, in Amsterdam mainly. But actually I've seen people come into anthropology from very different backgrounds, so you could come in from a healthcare background, or from humanities, or from sociology, or even philosophy, and that can then be a really interesting mix with understanding these ways in which anthropology tackles and approaches issues, the focus on the social relationships, and mainly this method also spending lots of time and hanging out with people to understand their view and their practices, really, of how they see the world, make the world, and live their life, and try to change it in some occasions for the better. So I work at a university where I do research, and I also teach students about anthropological methods and theories. But as an anthropologist, you could also work in other settings like advocacy, or in government, humanitarian efforts, in the healthcare sector, you name it. So anthropology is like a lens through which you can see things differently and open up possibilities for doing things differently and hopefully better, but it depends better for whom. So it also comes with a reflexivity on what we as researchers bring to the field and to the questions. But yeah, I believe anthropology can make important differences by challenging some of the things we've forgotten to ask questions about. So yeah, thanks for listening.